Good to have you tuned in. You're watching the Daily Report for Friday, March 18th. Efforts to ease social restrictions continue here in Korea despite the daily tallies, as authorities say the current COVID-19 situation remains within medical capacity. We start now with the global pandemic numbers. I have Kwon-so standing by. So do start us off then.
Sure, Sunny. COVID-19 infections here in the nation have dropped to the 400,000 level this Friday. 407,017 cases were counted as of 12 a.m. And that includes almost 407,000 domestic transmissions and 39 cases from abroad. Now, with that, the average number of daily infections in the past 7 days now stands at above 400,000. Now, meanwhile, we do have this plunge from the day before. Officials on Thursday afternoon explained that this exponential figure of above 600,000 is attributed to some cases that have been added on Thursday, which have not been counted a couple of days before. And now let's move on to our map. We've got over 113,000 cases in Gyeonggi-do province, followed by close to 82,000 cases in the capital Seoul. Now there's a mix of 4-digit and 5-digit figures across the nation. And the total number of cases now in Korea stands at above 8.65 million, and the number of fatalities at 11,782, with 301 people added in the past day. And now let's take a look at the number of patients in severe or critical condition. It continues to be at above 1,000 for over a week now, but it is a drop from the day before. Onto our vaccination figures. Around 2,400 people and around 2,600 people have received either their first or second shot of COVID-19 vaccine, and 42,852 people have been administered with their booster shot on Thursday. Onto the global figures, more than 2 million new infections have raised the total to 466.4 million in the world, and around 6,600 people have lost their lives in the past day. Going over to the 20 countries with the highest accumulated caseloads in the world, we've got the UK having hit the 20 million mark in the past day, and to Germany, 18 million. In fact, Germany had another record high in its caseload the day before. And those are the general updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, back on the local front, there's been a slight further ease in social restrictions, and for details, I have Han Sung-woo here in the studio. Sung-woo, welcome back.
Good afternoon.
Right, so the cap on social gatherings will be lifted, that is, starting next Monday. Tell us about that.
That's right, Sunny. The government has eased social distancing rules to allow larger private gatherings of up to 8 people max, 2 more than the current 6, starting Monday for 2 weeks until early April. That's regardless of vaccination rules, by the way, as it is now and personally as it should be. Business hours for restaurants and cafes, however, will not be extended to midnight from the current 11 p.m., contrary to some expectations. Officials explained this morning that now is not the time, pointing to the recent increase in the number of patients in severe or critical condition.
It's time to modify the current social distancing scheme, but it's too much of a risk to drastically ease measures, considering the Omicron surge and the uncertainty surrounding its peak, as well as the strain on the medical system.
As we all know, Korea has been gradually easing virus curbs to restore a sense of normalcy despite the ongoing Omicron surge, largely to help small businesses and the self-employed hit hard by the pandemic. So lifting restrictions altogether was considered a possibility, but those hopes were dashed over the past few weeks as cases soared well into the 6 digits. Health authorities are attributing the recent uptick in daily cases to both the adoption of rapid antigen tests for official purposes and the spread of the BA.2 Omicron subvariant, the stealth Omicron, which experts say has risen from around 17% of cases in February to 26.3% as of the second week of March. Given the circumstances, they've recently acknowledged the peak of the wave could last longer than initially expected.
Right, and staying here in the country, Sung-woo, I hear new studies by authorities in the country shed more light on the infectious period of Omicron patients. Tell us more.
Sure, Sunny. Omicron patients may remain contagious for up to 8 days after symptoms surface. In other words, there's virtually no risk of transmission 8 days after an infected person shows symptoms. That's according to Korea's Central Disease Control Headquarters, which analyzed 558 samples from people infected with Omicron. The result caused some public confusion considering that under the current system, isolation for the infected is lifted 7 days after taking a COVID-19 test. Officials explained, however, that the variant's transmissibility drops significantly on the 8th day, to the point that there's no need to extend the quarantine period. The study also showed that people who've had two or more vaccine doses compared to the unvaccinated are less likely to spread Omicron.
Right, and we have more insights into those findings during our panel discussion later on. In the meantime, Song-woo, do stay for more talks.
Sure thing.
Right, let's now turn to Soa, who is back at the desk with the most recent government remarks regarding Korea's COVID-19 situation. Right, Soa?
Right, Sunny. First, some more explanation on the reason for the adjustment of social distancing measures, which Song-woo briefed us on a bit before. While last time the operation hours for businesses was extended to 11 p.m., this time officials aimed to alleviate discomforts of the general public in allowing bigger groups to gather, is what they said. And they also said that the record high of more than 600,000 daily infections just a day ago also played a factor, adding that the nation's virus prevention is in quite a difficult situation. Officials note, though, that stringent social distancing rules we lived with during the Delta wave are no longer as effective as during the current Omicron wave, stressing the number of daily cases is not equivalent to the nation's managing of the ongoing pandemic.
Unlike our approach with the Delta variant and the original strain, where we looked at daily case counts as a barometer of success in our prevention strategy, our current measures aim to minimize the number of deaths and severe cases while restoring a sense of normality. During this process, the degree in which we can mitigate the damage caused by COVID-19 while returning to our normal lives will be seen as a key factor in our evaluations. Our death rates are falling, and the number of fatalities per 100,000 people is more favorable and stable compared to countries abroad.
Right, and regardless of that relative stability, so I understand authorities remain devoted to bolstering their medical capacity, right?
Exactly. Officials predict actually that the number of COVID-19 related deaths and also the number of severe and critical patients is expected to rise after we reach the Omicron peak, that is, for another couple of weeks. And this is why they laid out further plans to make hospital designation and treatment more efficient. They also promised to do more to tackle the shortage in hospital beds in specific regions. While the nationwide occupancy rate of ICU beds stands at 66.5% nationwide as of this Friday, in some places it stands at above 80 or even 90%. The southwestern city of Gwangju only has one ICU bed left out of a total of 54, and nearby in Jeollanam-do province, only 3 out of a total of 22 were said to be available. In the southeastern Gyeongsangnam-do province, 54 out of 63 are filled up. According to an official, this can be attributed to the non-capital region making up around half of the nation's total caseloads lately. And in the cases of places like Gwangju and Jeollanam-do province, there is a high population ratio of people aged 60 and above that could be seen as the reason for a higher proportion of patients with severe symptoms.
I see. Meanwhile, so people arriving into the country from overseas are also poised to witness some changes, I hear.
Right. So starting on Monday, the 21st, most people arriving from abroad here in the nation will be exempt to a mandatory quarantine period that we had before. There will be some exceptions, though. That will be people arriving from Pakistan, Uzbekistan, Myanmar, and Ukraine. And fully vaccinated means people who either received their booster shot or people who have passed 2 weeks after their second dose or are still within 180 days after receiving their second dose. And then there's also the possibility for people who have received their second dose and have been infected but have fully recovered from COVID-19.
Right, I see. And now for COVID-19 news beyond national borders, I turn back to Song-woo, who has updates from Germany, where authorities are fighting a very dire situation, I hear. Tell us more.
The situation isn't good, Sunny, not good at all, to the point that German lawmakers are actually mulling over whether a vaccine mandate for all adults would be necessary, opposite government officials who are championing an easing of antivirus restrictions. According to data compiled by the Robert Koch Institute, the country hit a new all-time high in daily infections on Thursday, with just under 295,000 cases, along with 278 COVID-related fatalities, to drive the death toll up to more than a staggering 126,000. A final decision on an initial proposal to make inoculations compulsory isn't expected to come soon, though. Opponents have suggested mandates only for people above 50 years old, while others reject the idea altogether. Despite the alarming surge in cases, German officials have defended plans to leave some of the nation's antivirus curbs to expire on Sunday. They want to let the country's 16 states autonomously decide where restrictions should be targeted rather than impose nationwide rules.
Meanwhile, over in the U.S., Sungwoo, I hear there are signs of a possible rebound in infections in a number of states there.
That's right, Sunny. According to the CDC, 38% of wastewater sampling sites that they track showed virus rates had risen over 2 weeks between late February and mid-March, a possible sign of a resurgence in some parts of the country, even as the number of positive tests dropped nationwide. 2% of the 688 sites showed a 1 to 9% increase in levels from February 27th to March 13th, while 9% showed a 10 to 99% rise, 12% a 100 to 999% increase, and 15% a jump of 1,000% or higher. CDC data shows the same period saw the number of daily infections diagnosed through standard tests plummet by more than 45% across the country. To give you some background on how this works, genetic material of COVID-19 is detectable in the sewage of infected people, including asymptomatic individuals. It's too early to tell if the recent data is hinting at a resurgence, but the CDC advised keeping a close eye on wastewater data as an early warning if numbers continue to rise. Experts say they could reflect an uptick in cases from the easing of prevention measures, such as the lifting of mask mandates by state governments.
And speaking of the U.S., President Joe Biden actually just has named a new White House COVID-19 response coordinator on Thursday local time. Epidemiologist Ashish Jha, who will be replacing Jeff Zients next month, who has been in the job for more than a year. Biden gave credit to Zients for America's vaccination process and fighting the pandemic, while expressing hopes for Jha, calling him the perfect person to execute the nation's COVID-19 preparedness plan and managing ongoing risks from the virus as the U.S. enters a new moment in the pandemic, is how he said. And that's suggesting that the Biden administration is getting closer in its pandemic to endemic policy shifts.
Staying on the international front, so I understand Italy has shared its exit strategy. Tell us about that.
Yes, Italy's Prime Minister Mario Draghi made this confirmation on Thursday that starting on May 1st, Italians won't have to prove their vaccination status when entering public venues. So Italy actually had one of the strongest so-called Green Pass systems in Europe implemented in fighting the pandemic. The country's regional color-coded system, which decided virus restrictions by region, will also be scrapped. So will be the vaccine mandate for workers aged 50 and above to go to work. The health ministry, meanwhile, decided to lift mask mandates for indoor spaces starting on April 30th. Italy's state of emergency is scheduled to end by the end of this month, which also means the nation's COVID-19 Advisory Technical Scientific Committee won't be in place anymore, and it will be replaced by an operational unit within the health ministry.
I see, Soa. As always, and thank you very much for the coverage. See you on Monday. And Sungwoo, thank you for your input this week.
It's been a pleasure.
We start our news segment on this Friday afternoon with the latest events over in Ukraine as losses of innocent lives continue to mount, even as dialogue to end Russia's hostile campaign takes place on many levels. Victor Flood reports.
Russia's invasion of Ukraine is now into its fourth week, and the number of civilians killed so far is estimated at around 780. The UN says this figure includes nearly 60 children. Over 1,200 civilians have also been injured. As the shells and rockets continue to rain down, satellite images show the extensive damage done to civilian infrastructure and residential buildings in many parts of Ukraine. At least 21 people were killed on Thursday in Kharkiv, a city in the northeast of the country, following a Russian attack involving a relentless barrage of artillery and rockets. Russian forces destroyed a school and community centre in the city, which has been under heavy bombardment since the onset of the war. Against this backdrop, the Kremlin said Thursday that Russia was putting, quote, colossal energy into talks to reach a peace deal. However, it added Russia is not seeing the same zeal from Ukraine. While Ukraine says it's willing to negotiate, it insists it won't surrender nor will it accept Russian ultimatums. Moscow continues to reiterate that it wants a neutral Ukraine as well as what it calls the demilitarization and denazification of Ukraine. As diplomatic efforts continue around the world, US President Joe Biden is expected to talk over the phone on Friday US time with his Chinese counterpart Xi Jinping. The White House says the call is part of Washington's ongoing effort to maintain open lines of communication between the two superpowers. US officials say Biden and Xi will discuss the war in Ukraine and other issues of mutual concern. Victor Flood, Arirang News.
On the economic front, the repercussions of Omicron and further geopolitical confrontations are weighing down on Korea's consumer sentiment despite the expansions in exports and employment. Our Min Soo-kyun explains.
South Korea's major economic indicators are showing signs of growth, but the blazing spread of the Omicron variant is feared to hurt the recovery in domestic demand. In its monthly economic report on Friday, the finance ministry said the country saw a sharp rise in employment and exports. Last month, South Korea posted its biggest on-year job growth in 22 years. The number of people employed stood at 27.4 million in February, up 1.04 million from a year earlier. Exports also extended their growth, rising by more than 20% on-year on the back of solid outbound shipments of semiconductors and petroleum products. Despite these encouraging numbers, however, the finance ministry expressed concerns over domestic demand.
Recently, the Korean economy has continued to show a solid growth in exports and employment, but there are concerns over constraints to recovery in domestic demand due to the COVID-19 variant.
Following a surge in new infections, South Korea's consumer confidence fell in February. The composite consumer sentiment index stood at 103.1 last month, down 1.3 points from the previous month. The finance ministry also noted that uncertainties remain high from external economic risks, including the recent U.S. rate hike and Russia's war against Ukraine. The ministry vowed to take risk control measures to cope with such uncertainties, driven by both internal and external factors. Min Soo-kyun, Arirang News.
In other news, Seoul's Environment Ministry is hosting a special exposition aimed at easing our carbon footprints by calling on drivers to go green. Lee Tae-yeon was there.
The electric vehicle industry is thriving in South Korea. According to data released by the Ministry of Trade, Industry and Energy on Wednesday, domestic demand for eco-friendly cars increased over 52% in February compared to the same period last year. Among them, sales of electric cars more than doubled. In line with this trend, the Ministry of Environment is holding its Electric Vehicle Expo XEV Trend Korea 2022 in Seoul for 3 days starting Thursday. Major players in the market, including South Korea's auto giants Hyundai Motors and Kia, will be showing the latest in electric mobility trends such as electric motorbikes and advanced automotive batteries, as well as this year's new EV models. One of the highlights of the expo is the EV Awards 2022 zone, which showcases the electric vehicles that had the highest evaluations from experts and consumers in terms of futuristic design and functions.
I work in the automobile industry, so that's why I got more interested in electric vehicles. I prefer them because they are more eco-friendly than internal combustion engines.
Other technologies, such as electric charging solutions, were also on display. Some of the latest charging technologies adopted QR codes so people can use an app to pay to charge their car. One local government official at the event said some of these technologies will be used as Seoul City is planning much more infrastructure for electric vehicles.
The Seoul City government is aiming to supply 400,000 electric vehicles until 2026. To do that, the government is working on ways to improve the driving environment, such as installing 220,000 charging stations within 4 years to resolve charging station shortage issues.
As more people are willing to buy electric vehicles in South Korea, more automakers are releasing innovative models and technologies that could improve driver experience. And with the government's efforts to expand the industry, a new era in electric vehicle is clicking into gear. 이래현, 아리랑 뉴스.
Let's take a look at what's going on in the world now. Cuba said Wednesday it had sentenced upwards of 100 protesters in Havana to between 4 to 30 years in prison for island-wide demonstrations last July. The two-day protests from July 11th to 12th saw thousands take to the streets in towns and cities throughout Cuba, with many furious over shortages of food, medicine, and electricity. The protests also came at a time when COVID-19 cases were soaring in the country. However, human rights groups, the U.S. government, as well as the EU, have said the trials lack transparency and due process, and that the long prison sentences handed down were disproportionate to the crimes committed. Sentiment also shared by the families of those convicted.
They are putting them in jail for many years for throwing a stone when there have been people here who have killed human beings, whose sentences have been for 7, 8, 9 years, while they have been sentenced to serve the maximum for throwing a stone.
The government argues that the throwing of stones and bottles at officials and the police landed the protesters the long sentences. A judge in Honduras on Wednesday authorized the extradition of former President Juan Orlando Hernandez to the United States on drug trafficking and firearms charges. The decision was announced on the Twitter account of the country's judicial authority. U.S. authorities claim the right-wing former leader participated in drug trafficking from 2005 and 2022, while also being accused of accepting millions of dollars in bribes to protect drug traffickers from investigation and prosecution. Hernandez's defense attorney says they'll be filing an appeal to try to avoid the extradition. Amazon announced on Thursday that it had closed an $8.5 billion deal to purchase MGM as it looks to draw in consumers with more streaming video. In the statement, Amazon said it would welcome all MGM employees into the company and work with the studio's leadership, an indication that there would not be any layoffs. The deal with MGM means Amazon Prime can offer more than 4,000 additional film titles and a long list of TV shows, helping the company compete with streaming rivals Netflix and Disney+. The annual New York City St. Patrick's Day Parade returned for the first time in 2 years, as Manhattan's Fifth Avenue turned green with crowds dressed in emerald. Along with the massive crowd, marching bands, performers, and politicians all walked to celebrate Irish heritage, along with the members of New York City Fire Department and Police Department. The parade drew visitors from both overseas and across the country. 이 승재, 아리랑 뉴스.
It's Friday and time for a weekly focus on events beyond Korea. Today we turn to neighboring China, where authorities are fighting one of their worst COVID-19 outbreaks since the start of the pandemic. I have Jonathan Chang live on the line. Jonathan, it's good to have you on. Jonathan, can you hear me?
Thanks for having me.
Right. Jonathan, let's begin then with a few words on the rebound in COVID-19 infections over in China.
Yeah, in the past few days, we've seen a lot of cases. This is the Omicron outbreak, the variant that a lot of us are familiar with now around the world. We saw cases rise to the highest level since the pandemic first emerged in Wuhan in early 2020. In the past few days, we've seen cases come down a little bit, but there was another rebound again today. So we're still at up around the levels where we levels we haven't seen in the past 2 years. Let's put it that way.
Right. Jonathan, China's zero COVID strategy appears to be having severe economic repercussions that are looking to perhaps further aggravate the frail state of the global economy. What more can you tell us?
Yeah, China earlier this month said that it would set its GDP target for this year at 5.5%, which is actually quite high as far as most economists are concerned. So they set quite an ambitious target, but then within days, we started to see not only Shenzhen, which is the city that sits next to Hong Kong, but also Shanghai, both go into various forms of lockdown. You also have, Jilin province up on the border with North Korea also implement a province-wide lockdown. So it's raised a lot of questions about whether or not this is going to bring down GDP this year. A lot of economists have already started to lower their forecast. Many of them do not believe that China can hit 5.5% this year. But of course, it's only March, so we still have a long time to go.
Right. And moving beyond the outbreak there right now, Jonathan, there are pundits who claim that China is seeking to deflect the COVID origin blame by crafting, so to speak, its own narrative, which largely finds fault with the US. Do you care to elaborate?
Yeah, this isn't brand new. They've been saying this for about 2 years now. They've suggested that possibly COVID didn't start in China. It may have started somewhere else. It may have been started in a U.S. military lab. They've suggested. They don't have a lot of evidence to support that, but that's a claim that's been made. They've also talked about COVID coming into China on packages, on boxes, on imported seafood, on things like this. And the WHO has not ruled it out entirely. Most scientists are quite skeptical that this is possible. We haven't seen outbreaks in other countries spread this way. But, I think what China's trying to suggest is that we still don't know definitively where COVID came from. And that's true. I don't think that any scientist can say with 100% certainty that they know where it came from. And I think this has helped China sort of suggest that responsibility may not just, it may not be a China thing. It may be, who knows where it came from.
Right. And moving forward, Jonathan, what has been the response in China to the result of Korea's 20th presidential election?
Well, I think people are obviously watching in China. They're watching what's happening in Ukraine. They're also looking at what's happened in South Korea, in Japan, in other countries that are closer to China as a result of what happened in Ukraine. And obviously, Yoon's election in Korea had far more to do with what's happening in South Korea than it does with what's happening in Ukraine. And yet, when you're sitting in Beijing and you're watching the world and all of these developments, you're seeing the West start to become more united against Russia and indirectly towards China as well. And I think they're worried to see, a similar trend happen in Tokyo as well as in Seoul. Again, it's not entirely clear what the new administration in Seoul will do towards China, but I think most people share the consensus that it's going to be less friendly towards China. And I think that is certainly not going unnoticed here in Beijing.
You mentioned Ukraine, Jonathan. In fact, staying with that, then, how are stories of suffering in Ukraine amid Russia's hostile campaign being covered over there in China?
Well, it's been a little bit mixed because I think, as we all know, China and Russia are they're neighbors, and they have had close ties for many years. Ideologically, they're aligned. And so you had Vladimir Putin in Beijing just a few weeks ago, standing side by side with Xi Jinping at the opening of the Olympics. They talked about having this no limits sort of partnership. So, at the same time, China's tried to project a certain sort of neutrality. They're despite all this, they're trying to also suggest that they're not against Ukraine. They're also supporting Ukraine, but I think it's undeniable that many people in the West have a perception of China being closer to Russia. And so, in the media, it's actually been, on social media in particular, you do hear a lot of voices that are pro-Ukraine. You also hear a lot of voices that are very pro-Putin and very pro-Russia. So it is a bit of an ambiguous picture right now. But I think state media, certainly it's in the eye of the beholder. But I think there are a lot of signs that make for a strong argument that state media has been pretty supportive in some ways of Russia. They haven't called it an invasion, for example, and they've called for, talks and for calm on all sides. You know, they're loath to sort of point the finger at Moscow.
Right. All right, Jonathan, thank you very much for your time and your thoughts.
Thanks for having me.
The Omicron wave is largely expected to be our last major battle with COVID-19, and that is perhaps why authorities are working to actively re-establish a sense of normality within the society. For more, I have Dr. Alice Hyung-Dan at Ms. Medi Women's Hospital live on the line. Dr. Dan, welcome back.
Thank you so much for having me.
Also, in the spirit of social distancing, I have Professor Kim Eun-gyu at Yonsei University joining us virtually as well. Professor Kim, it's good to see you.
Thank you for having me.
Dr. Tan, let's start off with your assessment of the latest revision to our pandemic-related guidelines then.
Well, you know, I think the consensus among medical professionals is that the levels of transmission that we have seen recently are not sustainable. And so, in my opinion, I think we really need better management of the transmission levels. And I have 5 major concerns. First of all, we have 939 ICU beds open around the country right now. But if you consider that we've had 725,000 high-risk cases over the last week alone, and there's a conversion rate to severe disease of 0.6%, you know, if you just do the simple math, we will know that we will be running out of ICU beds pretty soon. And so that's one of my big concerns. The second concern is, of course, the legacy effect of long COVID. We know that it affects multiple symptoms. We don't know how long these symptoms and these systemic conditions will go on for, but we do know that the larger the pool of people who are affected by COVID, the larger the chance that they will have a risk factor for a chronic disease. Right now, we're at 8 million, a little over 8 million cumulative cases, and that's a huge portion of our population. And so I'm concerned that we are perhaps exposing too many people to having risks of long COVID. Also, I'm concerned about whenever you have increased transmission, of course, you have increased risk of the formation of new variants. And that will be a very self-defeating proposition right there, because, of course, if we have a new variant that is perhaps more transmissible or more lethal than previous variants of concern, then we may be right back where we started. And so that's another reason why we want to bring transmission levels lower. Finally, it has come to everyone's attention, of course, that we are seeing so many deaths due to COVID recently that it is becoming difficult for us to bury our dead. And that is such a very heartbreaking situation. Not only is COVID preventing people from having proper burials after the traditional 3-day and night wake, COVID has also prevented the dying from having a proper, warm, comfortable, peaceful dying process where they are able to be surrounded by family, say goodbyes, say thank yous, and have proper closure at the end of life. And so for all of these reasons, I really would like to see transmission levels go down. I think, in my opinion, that we need to do more.
Right. And Professor Kim, based on your observations of the Omicron infection here on the local front, what are your prospects with regard to its spread in the near future?
Total cases of COVID-19 increases by spreading itself, and more testing, including asymptomatic patients at school, and using one more method, which is rapid antigen test to count. Now, Korea's 7-day average of cases per population have reached the level of Denmark's peak, which was about 8,000 per million. Denmark has already passed its peak, but I guess we are not yet. And Israel is a country with a highly vaccinated population. Strikingly, Israel's peak was more than 10,000 per million. So if we follow the steps of Israel, it might take 1 or 2 more weeks to reach the peak. New measures to ease social distancing may further increase cases, but I guess with only a minor effect. We are concerned about the peak, the total cases, and severe cases. Which one is most important? My answer is severe cases. We have to give the best protection for people with underlying conditions. And I hope all our resources focused on preventing and treating those severe cases.
Right. And Dr. Dan, authorities have said that the Omicron outbreak here in the local front may be a prolonged affair. Having said that, what preparations do you propose?
Well, first of all businesses, institutions, they need to have a plan B. They need to have a business continuity plan in place just in case there's a large number of employees who become sick with COVID and cannot come into work. We also need to focus on continuing to vaccinate the unvaccinated, boost the undervaccinated, and make sure that all immunized peoples of all ages, including children, have had up to 4 doses. Lastly, I would like to see more effective deployment and use of the potentially life-saving antiviral pill Paxlovid. Right now in Korea, it's indicated for anyone age 40 and above who has a risk factor for severe disease. But I know a lot of people who have had difficulties in accessing this medication. So I think we need to work harder to make sure that anyone who might benefit from this medication has access to it and is able to take it safely.
Right. Professor Kim, you mentioned the rapid antigen tests. What do you believe has been the impact of professionally conducted rapid antigen tests on our containment efforts?
Rapid antigen test is not sensitive in detecting asymptomatic or early symptomatic patients. But we can say we have one more modality to confirm Omicron. As every student at school are tested with rapid antigen test twice or 3 times a week, this will add on new cases. If it is possible, if it is positive with the rapid antigen test, the virus may have already spread throughout the class and family. So it will have limited effect stopping the spread at school.
Dr. Tan, you mentioned Korea's COVID-19 death toll, which remains in the triple digits, and that the number of severe cases, both you and Professor Kim have mentioned, stands well above 1,000. Having said all that, do you believe this reality is well within our medical capacity? And if it's not, is there a way to perhaps bolster it?
Well, we already have 4 cities and provinces that have less or equal to 5 ICU beds left. We have 6 cities and provinces that have 10 or fewer ICU beds left. And so hospital systems are already being very, very strained as it is. And we have to remember that when, the government says that we have secured more ICU beds for the treatment of COVID patients, these beds are not appearing magically. What's happening is beds are being diverted from the care of non-COVID patients to COVID patients. And so basically what that means is many people are having their surgeries, non-urgent or elective surgeries delayed in order to make room for COVID patients. So if we look at the situation holistically, as I said, this is not a sustainable situation. Not only are we going to have a bed shortage soon, but also concerning is a lot of nurses, a lot of doctors as well are also getting sick with COVID. And so we are now faced with staffing shortages. And so this is why I am really calling for better management of transmission levels so that we can get the numbers of patients who are especially at high risk, who are getting newly infected, get this level down. In addition to that, though, we do need to work on being more efficient in terms of our turnover of patients who are in ICU settings. Make sure as soon as they are well enough to be stepped down, as we say, they go from ICU to sub-ICU, and then from sub-ICUs to the general ward. And from the general ward, if they are well enough and not contagious, perhaps they can be transferred to a skilled nursing facility. And this needs to be on a daily basis, maybe every 8 hours, so 3 times a day. Bed availability and transfer of patients need to be done on a very, very efficient way.
Right. And back on the testing front, Professor Kim, some people have reportedly been shying away from COVID-19 testings despite having symptoms. Is there a way to address this particular problem, in your view?
We cannot force everybody to test. Before the Omicron outbreak, most of the patients were willing to have PCR test. But now I can easily find someone who is not willing to. There are some reasons that we don't know why they are refusing. But if you have admitted to hospital, it is mandatory. And if you live with someone who have underlying condition, testing and quarantine is mandatory. If you are planning to have a close contact with somebody chronically ill or not vaccinated, and you have minor symptoms and not tested, it is wise to cancel it. And you better get tested with accurate methods like PCR. If you work at the hospital or nursing homes, you better follow strict testing rules, as we are seeing hundreds of mortality nowadays.
Right. And Dr. Tan, some studies appear to cast doubt on the policy of a 7-day quarantine timeframe for COVID-19 patients. What are your thoughts?
Well, as was mentioned earlier in the program, research was done here in Korea where they looked for a culture of viable virus from people at various stages of infection. And what they found was even on day 8, they were able to culture viable virus, but the amounts were very, very low. And the opinion was that it would be very unlikely that a person would be infectious beyond day 8 or beyond day 7 of infection. And so I don't think we need to prolong the isolation period. I think from day 1 to day 7, we assume that a person is infectious. Of course, if a patient continues to have symptoms, then also they may be infectious. But beyond day 8, the recommendation is to wear a mask and be very, very careful, avoid any high-risk areas such as nursing homes and hospitals. But I do not think we need to prolong the period of isolation beyond 7 days.
Right, and staying with those studies, Professor Kim, others reportedly show that fully vaccinated people are less likely to pass on COVID-19 to those around them. Over 86%, that is, of the people here in Korea, Professor Kim, are fully vaccinated and almost 63% are boosted. But still, we are recording 6-digit daily tallies. How do you interpret this reality?
Current vaccines are designed for original Wuhan strain. And for Omicron, vaccinees may spread less than unvaccinated, but Omicron is highly contagious. It is not as the original Wuhan strain. It is much more contagious. So it is spreading like a wildfire. If we were not vaccinated, it would have been more devastating. So when you look back, Korea did well on quarantine for the last 2 years. But immunity by natural infection was very low since recently. This might be another reason why Omicron outbreak is much worse compared to other Western countries.
Dr. Tan, I understand this next question may be premature, especially given the current situation here on the local front. But when do you suppose can we declare an end to the pandemic here and perhaps the start of an endemic phase, which would no doubt entail very significant, very different containment strategies, that is, including the lifting of mandatory quarantine?
Well, if we look at the pandemic from a global perspective, unfortunately, I hate to be the bearer of bad news, but I don't think that the end of the pandemic is near. And the reason why I say that is because we obviously have geopolitical conflict regions where the pandemic is raging and there is not a lot of monitoring. There's, of course, not infectious disease prevention and control, right? That right now is just a matter of surviving a war. And then, of course, we have many regions around the world where vaccination rates are not high. And so those are the two reasons why I don't think the end of the pandemic is really anytime near. However, that doesn't mean that we shouldn't start planning for brighter days. And once we see lower transmission levels, of course, in our acute sort of crisis that we're in right now, we really need to look out for test positivity rates. Right now, they are exceedingly high. And until these positivity rates go down, I don't think we're going to see significant decreases in the daily case counts. But one day, we will get over the Omicron wave, just as every country has. What we need to do, though, is continue to monitor, especially genetic surveillance, to make sure that we can catch the new variant of concern early and have a plan in place for what to do. And as was mentioned previously in your broadcast, perhaps if we institute wastewater surveillance, that may also help as a way of gauging where we are in the pandemic and catch outbreaks sooner than just waiting for people to come in to get tested if they have symptoms.
Right. And staying with premature questions, Professor Kim, this is an impromptu question. The World Health Organization has said it is too early to declare an end to the pandemic, but officials there are looking into the criteria needed to declare an end to the pandemic. Having said that, what do you believe should be included in that particular criteria? When can we say that the pandemic is officially over and we are entering an endemic state?
Before we want to say it is the end of pandemic, we have to look back on the world map one more time. And as I said many times, there are so many blind spots in our world map. And as you can know, two of the major mutants of COVID-19 came out of Africa. And well, I guess at least 20% of the world population is located there, but the vaccine rate is very low. And most of the higher income countries already have third shots and even planning for the fourth. But we don't know whether we might have another mutant coming out of Africa. So we should not have a blind spot in the world map first. And I wish that we are more concerned about our neighbors, especially located in lower or middle income countries. And that is one of the preconditions that we can say this is the end of the pandemic.
Right. And Dr. Dan, this is also another impromptu question for you. You mentioned long COVID as we started this particular discussion on this Friday. And keeping that in mind, there are some doctors here in the country, Dr. Dan, who claim that you might need to take an X-ray of your lungs after you recover from COVID-19, regardless of whether you were asymptomatic or had severe symptoms. Could you explain that recommendation for us?
Well, in general, if you've had symptoms for more than 4 weeks, that's when we recommend that you go into a clinic and have a full checkup, and a chest X-ray would be included in that. There are some concerns that, as I mentioned, with long COVID, even people who are asymptomatic with the initial infection, they can develop shortness of breath, they can develop heart conditions, chronic lung disease. And so that's why it's a good idea just to get a chest X-ray. Some doctors are recommending to just screen for fibrosis, for signs of residual pneumonia, anything that could lead to a potentially more severe condition. I think this would apply for people who are at high risk of having pneumonia and severe lung disease, certainly the elderly and anyone who's been hospitalized I would recommend getting a follow-up chest X-ray 1 month after the acute illness.
Right. And Professor Kim, for the sake of our viewers here, amid the transition from winter to spring, do remind us about the symptoms of Omicron as compared to those of the common seasonal allergies.
Omicron is almost indistinguishable from seasonal flu, but if I compare with allergic rhinitis, allergic fever, and the main symptoms are sneezing, nasal obstruction, and itchy sensation on nose or eyes. Sometimes it's seasonal, sometimes it's non-seasonal, and you might have a known allergen, but many times you don't know causing it. Mild allergic rhinitis may not have higher risk for Omicron infection, but severe and chronic allergic rhinitis usually have a weak mucosa and have chronic inflammation. They have a higher risk for various pathogens, including Omicron. So if you already have a allergic rhinitis, you don't have to worry. But if the doctor says you should be careful, then you better take care of not getting any kind of infection.
Right, so it is best to get the advice of your doctor as well, because there's been a slight disruption in the audio with your connection, Professor Kim. Dr. Dan, one final question to you before we say goodbye today. I was wondering, children aged 5 to 11 are starting their vaccinations late this month here in the country. What are your words of advice, very briefly speaking?
Well, we're seeing so many tens of thousands of children getting infected on a daily basis, and it's really disrupting their education. So my recommendation is for the high-risk children, definitely they should get vaccinated. For the healthy children, of course, they need to have a discussion with their pediatrician. But as a mom, as a doctor, as someone who has 3 children, I actually recommend vaccination. I think that's one of the ways that it could end this Omicron surge that we're experiencing here in Korea.
All right, Dr. Dan, as always, thank you very much for your words. Professor Kim, thank you very much for your insights today.
Thank you.
Right, well, that brings us to the end of this week's editions of the Daily Report. We'll be back with more coverage on Monday. Join us then. Have a safe weekend.